Thanks, Ashley. It's estimated that are performed every year in the United States to repair hernias. It's a condition that affects men, women, and children. So how do you know if you have one, and why is it so important to seek medical care? Here now with answers to those questions and more is Dr. Marko Lujic, a general surgeon who specializes in hernia repair at the Hospital of Central Connecticut. Dr. welcome.
Thank you for having me.
Thanks for being here. What exactly is a hernia, and how do they form?
So a hernia is essentially a hole in the abdominal wall. It can be upper abdomen and in the groin. They mostly form from overuse activities, strenuous exercise, age-related with increased risk as age increases, but it can be younger and old people. And also big fluctuations in weight, whether it's weight gain or weight loss, and really form due to a breakdown of the abdominal wall.
Wow, okay. Are there specific symptoms that someone would experience if they have a hernia?
So symptoms of a hernia usually start out as a noticeable bump, so on the abdomen or the groin. These bumps can also be associated with discomfort, sharp, dull, or achy. And then symptoms can progress. They can get to more painful issues and even skin changes such as redness and irritation to the skin, which then most likely would require a visit to a doctor or the hospital.
Next question, how do you get rid of a hernia?
So getting rid of a hernia essentially is a surgical issue. Hernias do not repair themselves. They are not like skin. They will not close over. Getting rid of them requires a surgical intervention where the hole in the abdominal wall is closed. It's not because of the aesthetics or because of the bump, but we do this to eliminate the risk of one of the organs from inside your body, mostly fat, getting stuck in this hernia, losing blood supply, dying, and then requiring a more emergent intervention.
All right, tell us more about options for surgery. Are they all the same, and is there a hospital stay involved?
So the options for surgery, as I mentioned above, if you're proactive and get to it before something becomes trapped in there, are three options. One is the older tried and true method of an open hernia repair where there's a larger incision, which is used frequently still in the right case scenario. And the other two are less invasive. One is collapse. One is a small little puncture made in the abdominal wall, and the patch is placed to cover the hole on the inside. And then one, which is a newer technology, is the use of a robot. And essentially it's a laparoscopic style with the aid of a new technology being a robot that is operated by the surgeon himself.
All right, Dr. Marko Lujic, thank you so much for joining us. Good information.
Thank you for having me.